The biggest lesson I took from Ribbon was that one, product market fit is not static, and two, you have to be able to measure the ROI of your product.
Akash, cheers.
Cheers. Thanks for having me.
Welcome to the podcast.
Thank you.
So I think we'll probably get started with just getting everyone familiar with your background. You've been in healthcare for a really long time and wanted to understand the through line for how you started in product and how you landed into being a founder. And then we'll unpack kind of each of those experiences.
Totally. We'll kind of give you the 120-second overview on me.
Cool. It's basically a recruiter pitch.
Yeah, exactly. So going back to even school, always been really interested in the intersection of healthcare and software. Studied computational biology, which is computer science and bio. Spent a lot of my time in college processing large amounts of patient data and then doing stuff with it. Thought I was going to go get a PhD. Kind of had an existential life crisis senior year and realized I didn't want to sit in a lab all day, not talk to folks.
Yep.
And so found my way to this entrepreneurship fellowship called Venture for America. Basic premise, take people that go to New York for SF, send them not there, do the work at startups. So I ended up in Cleveland of all places, working for a company spun out of the Cleveland Clinic that was doing clinical trial matching for cancer patients. And so I was actually started off not as a product manager, but as a data scientist, as a bioinformatician. I was building algorithms that read in patient information and then matched folks to target trials, clinical therapies. Very soon after joining that company, realized a lot of what I was doing was just building the same things over and over again, slightly differently for different customers, and realized that it made a lot more sense to build something once, make it configurable. At the end of the day, what we're actually talking about is a product.
Yeah.
That's really where my product journey started. I was just really frustrated that I was literally doing the exact same thing over and over again, slightly differently. Went to my boss, pitched him on the idea, like, can we build this properly one time and just make it configurable? Didn't even really know that I was stumbling into like my product career, which is where I spent most of my time since. So very shortly after that, helped build out like a whole product around data pipelines and algorithms at this company. Kind of stepped into like a product role informally and eventually formally. Was there for about 5 years. After that point, I was just really looking to get to New York or SF. And so found my way to New York, where I joined as one of the first employees at a company called Ribbon Health, which is provider data. So think about data on doctors, essentially what we were selling, and specifically for the use case of how do I help somebody get to like the highest quality, lowest cost doctor that takes my insurance, that's near me, and speaks Spanish, how to think about all the things we care about as patients, and help somebody find like the most targeted set of options. So I was one of the first hires there, did a little bit of everything. We'll chat about this probably, product market fit, early days.
Definitely.
But was really the main technical customer facing person in the early days, really figuring out what our customers wanted and then very rapidly building a lot of that product on the front lines. Second half of my chapter there, I spent a lot more time focused on our move up market. We were getting selling to startups in the early days. Toward the end of my time at Ribbon, we're really looking to break into health systems and payers. So large enterprise healthcare buyers, how do we think about deploying a product for them? And kind of spun up a business unit there where we were basically trying to figure out how a larger enterprise customer might leverage some of the technology we're using. Took a little break after that, traveled for a bit, came back stateside and joined a company called Medallion, which is the licensing and credentialing of provider space. So think about how does a doctor, when they get hired, be able to see patients and then bill insurance for those services. I led all of our AI automation teams there, which was super interesting. This was a company using, armies of operations folks and hundreds of operations folks to just do all this work by hand in-house. And my job was to really figure out how we could supplant some of that with technology and really improve like the gross margins of that business. And then most recently, I've taken the plunge about 6 months ago and started my own venture called Sonder, which I can share a lot more about. And
I'm excited to dive into that.
In the senior care space.
Cool. How did you get excited about healthcare in the first place?
Yeah, I mean, I think traditional, like classic, overachieving high school student, you think you want to be a doctor or scientist. I got to school and that was kind of why I was there. candidly very quickly realized that biology is just memorizing a lot of facts in books. And I was,
True.
one, did not enjoy it, and two, was not very good at it. And I was actually considering switching out of my major when somebody mentioned taking some classes that were more kind of like the combination of comp sci and bio. And that's really kind of where I like caught the itch, because I inherently love the problem solving aspect of technology and software. And then I like the intellectual curiosity of applying it to something that is, interesting or novel. And I think healthcare in particular is really cool because, you know, today's problems might be solved 10 years from now, but 10 years from now, there's still going to be a whole bunch of other things we don't know. And I like this kind of just never ending cycle of you don't know what you don't know. I mean, every day at work, I feel like I learned something new that I didn't know before. And that's 10 years in. So
Yeah.
I like appreciate the never ending like learning that comes with like working in healthcare and working on healthcare problems.
That makes sense. I also see that the healthcare industry has grown so much in New York over the last few years. And I'm curious on what you saw 5, 6 years ago when you moved to New York that basically recognize the fact that there is a lot of growth opportunity here in the healthcare space.
Yeah.
What's your vantage point on that?
Yeah. So when I first moved here, there were like two companies that anyone had heard of, right? You had Flatiron and you had Oscar Health. And I think a lot of what has happened in New York since is like kind of the mafia that was created from those companies, folks that have gone on and started other companies or doing interesting things. But beyond those two, there was kind of like maybe a set of like the first class of, I would say, like scaling venture growth startups. So put Ribbon Health, where I worked, as one of the major companies there. But everybody knew everybody. There were probably like 6 or 7 companies at Series A when we were at Series A at Ribbon, and everybody knew who each other were. Now I feel like you can't keep up with, somebody will send me a company and I'm like, never heard of it. And it's like 100 people.
Yeah. It's like the Silicon Valley of healthcare almost.
But I think, as we think about the pandemic, it forced, or I think, a really interesting recalibration around healthcare and the role technology had to play. And so I don't even think it's necessarily just a New York thing. I think like health tech as a whole has exploded since the pandemic, partly out of necessity.
Makes sense.
And obviously, there's been we can talk a little bit about like the downside of health tech in terms of like, where maybe it's gone too far and we had a little bit of a retraction in 2022 and 2023. But I think like it took like a step change inflection event to kind of really move the needle in a way that was substantial. And I think the analogy I always give folks is in the early 2000s, less than 20% of all medical records were electronic, right? And so even Epic, this big company that we all talk about, is like probably the most famous health technology company,
right?
That is almost a monopoly now. A lot of that change has happened in the last 20 years on the backs of like some government regulation requirements around moving all medical records electronically. So like it feels like some of these things have been for much longer time frames, but even like 15, 20 years ago, like we're still doing paper charts. And so I think like that we will look back on the pandemic as kind of this critical inflection point where like the next tranche of like innovation when it comes to technology and healthcare really arose.
So that kind of accelerated the trend in 2020, 2021.
Yeah.
And then maybe let's actually unpack the
Yeah.
2022, 2023 piece that you mentioned.
So the perfect example that I think drives this home is like telemedicine is like the most obvious thing you think of when you think, okay, like if I can't leave my home, but I'm not going to drop dead, like, and I need to seek care. Like telemedicine was, I think, probably the biggest riser and faller, right? In the pandemic, there were so many companies that came out, and they all kind of took the approach of, when you're starting a company, and even as a product manager, you're told to like start niche, right? Like make it work for like a small
specific problem.
And so it's like, I would maybe start a telehealth company for like, somebody with type 2 diabetes and heart conditions, and it's like very focused on improving their diet. And it's like a telemedicine dietitian company, right? Like people were getting so niche, but then you get kind of this really terrible like healthcare experience, which is as a consumer, I'm using a different platform for like the 8 different things that I need to manage. And I think none of those companies really hit the like venture scale that they needed to. And you saw kind of this overcorrection. it was an overcorrection, I think, to some degree, but also it kind of, we'll talk about product market fit. They had product market fit during the pandemic, but not necessarily post. And so the example I always give is, even as someone who works in tech, and I would love to be able to pick up the phone and talk to a doctor sometimes without leaving my home, I actually look forward to going to see my primary care doctor in person. And so when you take the pandemic conditions away, maybe the product market fit is not as strong as we thought. And obviously these companies are overcapitalized and are expected to grow at some rate. And so then you see kind of the pendulum swing back, and it still moved the needle forward, but I think a lot of companies had to die along the way for that to look actually, for those lessons to be learned in terms of like how to move forward. And I think we're going to probably see something very similar with AI in healthcare as well, where we're going to push the envelope as far as we can. We think we have early product market fit, and that'll retract. But it's not like, 2 steps forward, 2 steps back. I think it's more like 2 steps forward, 1 step back, and then we like reassess what the right direction is and then keep going.
Do you feel like, though, that more companies now in 2025 are more niche or more on the other side of the spectrum in terms of moving all in one as a healthcare?
Great question. I think I'm seeing a lot of the same patterns right now with the AI startups, where it's, prior authorization or revenue cycle management are like 2 of the most popular use cases for AI in healthcare. So revenue cycle management is when you, whoever you go see for healthcare, they have to submit a claim to the insurance company to get paid and reimbursed. And so what you're seeing is a proliferation of revenue cycle management AI startups. And, one person might do orthopedics, another person might do cardiology, another person might do oncology. And so you have all these startups where maybe they nail it for their initial use case. Then they need to go figure out how to do it for a second specialty, let's say. But there's actual real product challenges of cardiology and orthopedics are not the same. And so you got to go figure all that out. Your entire pitch to your investors is, we'll start with this and then we'll expand to everything. But then there's, 50 other startups doing the same thing. And so you're kind of all bludgeoning each other to death. So I am seeing a lot of the same patterns. That said, I do believe AI provides some very interesting opportunities to go broad.
Broad meaning cover more of the stack?
Yeah, but more so like more easily move, you like increase the surface area that you're able to cover. You could imagine going from cardiology to orthopedics being like the classic challenge I was just giving in that example. I think AI potentially unlocks the ability to do that kind of like ICP expansion a lot faster, especially as like the models can bring a lot of the insights and learnings, and you can ideally create really good frameworks and infrastructure for like taking that scaffolding to another ICP and then just seeding it with the knowledge it needs. And then you have like something much more turnkey. I think we're still in early innings to know if that will work. But I think there's like some really interesting companies that are betting more on like the infrastructure and technology they're leveraging to make it work, less so like the domain specific knowledge. And I think it'll be an interesting like tension between like subject matter expertise and like the technology, AI technology itself there.
Okay. Yeah. And then how do you see that impacting the way that companies are deemed successful in healthcare as a result?
It's a very spicy question.
Let's get into it.
Yeah. I think there's 3 or 2 at least ways I think about success. One is solve the problem. The other is like make money for yourself and investors, which is like the business is like successful under the whatever your agreement is with your investors in terms of like what the outcome should be. And I think one of the bigger challenges, I don't even think it's a healthcare problem, is you can solve the problem, but perhaps it's not a venture scale outcome if you're taking money from investors, right? And then you go chasing more revenue. We've seen this always, like product roadmap starts to become like this, like anything can make its way in as long as it generates revenue.
Right.
And I think I've seen so many good companies die because they had a really strong business, really strong product market fit, but we were overextended in terms of like what the expectations were. And so I think it'll be really interesting because I think we're in the same cycle of like hyper growth that we were in like the pandemic, with the ZERP era with startups, but we also are in an interesting place in time where I think you're seeing more and more startups seem strapped and like, we'll raise once or twice and then never raise again and build like a really sustainable business. And so it's going to be kind of interesting to see like now I think there's like another path that's become available with like AI and the ability to kind of do more with less. Can a company successfully grow to let's say some mode of like success without necessarily needing to be infused with capital every 2 or 3 years? And I think it's better for, in some cases, the founders. You hear stories about people that are selling their company worth $1 billion and they're making less money than the founder who sold their company for 50 million, like a year or two in.
Does that reduce the exit size ultimately for these companies as a result of taking in more or taking in less money?
I think it depends, right? I can give the example when we start chatting about what we're doing at Sonder. I think it depends on like to what degree you believe capital is actually going to unlock revenue for your company. Lovable and like the vibe coding platforms to me are a perfect example. They're really just a wrapper around the main LLMs with some tweaking. I would argue for them, more capital does equal more revenue because it's basically a game of who can
Growth.
get out. Yeah, growth. Who can get out ahead the fastest.
Yeah.
And then it's about the market and brand, right, that you've built on the backs of doing that.
Mm-hmm.
I think healthcare is very different because, especially if you're selling to large enterprises, it's a very slow process to get market adoption and like that J curve moment where like it starts to grow like crazy. Now, if you're in healthcare and you're selling direct to consumer or you're like going mom and pop clinics, I think maybe it's more plausible to say like bringing in more money when like investors actually helps grow revenue. For us, what we do at Sonder, we're selling to hospitals, like an extra 10 million in the bank is not going to make my deals close any faster. And so for us, it like I think changes the calculus for how much we raise. And I think that's like really what should inform how far down the venture backed path and how often and when people raise.
I think the good thing from a patient perspective is probably that if there's less pressure for these startups to speak back to their investors, that hopefully there's more focus on solving the right outcomes.
Yeah.
Cool.
1,000%.
So better for society.
Yes. Yeah. I think so.
Okay. All right. Let's pivot into Ribbon. And I want to understand your journey there as an early employee and let's talk to the product market fit path that you mentioned earlier.
Yeah. So Ribbon ironically started off as a care navigation company. And I would bring that up because the original idea for the business, this is before I joined, was we'll sell a tool to employers that they can give to their employees that helps them find a doctor.
Mm-hmm.
During that process, our founders realized that they were just basically churning customers left and right because people were upset about the data quality.
Mm-hmm.
They were pulling data from like the insurance companies' websites on like doctors, and it's like the phone number is wrong, the address is wrong, the fax is wrong. And so they're like, oh, like this is preventing us from building a successful like, consumer experience for like, any of us. Like we work for a company, we would just get this as part of HR staff to go like, find a doctor.
Right.
And so that was their like whole moment that like the problem we're solving was not the one that they initially started with, but it was like, we need to solve this data problem. It's like
they uncovered the problem.
Yeah, exactly. They're like started doing research. There's a really famous paper that came out in like 2019 that the Center for Medicare and Medicaid Services did, where they audited a bunch of like insurance company websites, the Find a Doctor tool that we all use, and it's like 50% of the phone numbers, addresses, and faxes are wrong. Mm-hmm. And so they were like, okay, this is a problem worth solving. And so it was kind of interesting. The product that they started with is actually the product that our customers would build with our API and data, which is kind of hilarious.
Yeah. Full circle.
It's very full circle. And so I went from this like very consumer facing experience to, by the time I joined, it was very clear we were going to go after this data problem. And we had already built an API and there was like an inkling of we will be like an infrastructure and API company, which is rare, especially this is like 2020 is when I joined. There weren't really many like data infrastructure focused healthcare companies.
Who were you selling to? Like, who were you selling?
Yeah. So at that time, it was like anybody that needed the data, and for the most part, it was startups. So imagine we were talking about those telemedicine companies. This is actually a great example. Some of our customers were these telemedicine companies where, let's say you go in for a visit, cardiology, virtual cardiology. We determined like, actually, you need to get some tests run. Now, this virtual cardiology practice does not have any brick and mortar locations. So how do they send you somewhere? And so we would actually power a find a doctor experience that they would leverage with our API. You know, our API would power a lot of that for navigating their patients to in-person care.
I see.
So that's kind of like where we started. And this is on the backs of the pandemic. So you can imagine like we're riding the wave with everybody else, maybe not directly in the context of like where healthcare was going, but we were kind of empowering a lot of that as well.
And so they were building, your customers were building their own user experience on top of that data? Or were you helping to co-build that with them in some cases?
So that's where this gets interesting is a couple of folks that were also early team members there were from Palantir. And so once we started going down this data path.
Oh, they were loving that.
Yeah, they were like, oh, this is interesting. Like, now everybody was like obsessed with the forward deployed model, but this didn't really exist like outside of Palantir at the time. So the idea that they were basically kicking around was, okay, we're selling data and an API. We have to be way more hands-on and way more technical with our customers to get them implemented. It's not like, let me give you my application and give you, a sign-on. And so when I joined, actually, like they were just looking for someone who's very customer-minded and good with customers and technical. And so I kind of stumbled into this like founding. It was like I was doing a lot of product, but it was like I would almost describe it more forward deployed. It was get these customers live, make sure they're leveraging the product in a way that drives the most amount of value, and then very much spend a lot of time with the customers, understanding what their pain points are, either that with the product itself or tangential pain points, and then rapidly build on the front lines with them, and then see what sticks.
Was that because they didn't have product managers yet, or were you partnering with people?
Yeah, there was my boss, Sahil, was like the VP of product. One PM was like internal facing, and then me. That was kind of like the team. But basically, it's like really interesting because, I think there's a lot of stuff maybe we less do now, but like certainly 5 years ago as PMs, which is just like rote like operational tasks you need to do to unblock your engineers.
Yeah.
I didn't spend any time on that. I spent all the time that I would be spending on that talking to customers, and really deeply understanding like where a lot of what we were doing fit into their workflows and how they thought about like value in the context of like what we were selling or weren't even selling yet at that point. I like to describe it as like investigative journalism. Like
I think that's important.
Yeah.
And I think more product management needs to kind of revert back into that direction.
Yeah.
Because I think a lot of PMs can tend to just hide behind the data and pretend that is them representing the customer. So that's good. Like to me, everything you're describing that you did is what a true product manager should do. You literally said, we care about what the customer's pain points are, and we're helping to build the technical solution with them. So, okay, nice. And then maybe talk through how that scaled over time.
Yeah.
In the context of both the product itself, but also the team and where your role kind of evolved.
Yeah. So I think maybe I'll send this to you so you can share it with folks that listen to the podcast. There is a thread on Twitter, which is my favorite tweet or piece of content about product management I've ever seen.
I see. Okay.
It's by this guy, Tris, who was, PM at Stripe. And it talks about a problem versus the problem.
Okay.
And the problems that get caused in a business and certainly in the context of products when you pick a problem to solve instead of the problem to solve. And so I'll like kind of describe this in the context of, we started off with digital health startups that have no idea what they're doing because it's in this like craze where we're all learning how to telemedicine for the first time, just like being like, we need to find a doctor tool for sending our patients to in-person care. Great. if you asked one of those practices what percentage of their patients need in-person care, they might tell you 1 or 2 or 3%.
Mm-hmm.
They were willing to pay, 20, 30, 50, whatever we were charging K for a product, but for them, it's an ancillary workflow. It's not critical to their business.
Mm-hmm.
And so that's not an insight we had, first and foremost. Like, you weren't that smart, but I'm just saying that now with hindsight.
Right.
And so what it really looked like when it comes to the evolution of the team and the product first, and I'll start with the team in a second, was figuring out, okay, we have really accurate provider data and an API that can power like somebody building the find care experience. Where are the places where this would help the most and is most close to the business value that the customer is looking to drive with their own business? And we, and I would say not by luck, but we kind of stumbled into where that actually was. One of our first customers at Ribbon, first enterprise customers, which is a chain of primary care clinics for seniors.
Okay.
And they engage in something called value-based care contracting. So for those that don't know healthcare, the idea behind value-based care is instead of getting paid for every service I provide, I get paid a lump sum of money at the start of the year for every patient that I manage. And then we're pulling from that pool whenever we need to do services for that patient. So basically, as the primary care physician, it's my job to make sure that we can deliver the highest quality and lowest cost care, because that's how I make money. Because if the patient ends up needing tons of care because we haven't done a good job of watching out for them, they actually make less money. So it's kind of this very interesting model where, like, if you go to a primary care doctor today, and that's not in one of these models, when they convince you to take one more blood work test, they get paid more. In this model, that wouldn't mean more dollars for them. And so it's more about very judiciously providing care and not doing unnecessary care. But then also, when there's really bad outcomes you can avoid, like the hospitalization, like how do you put time and money toward that? Because that's really where you can, one, drive a better outcome for the patient, but also make more money as a practice. So their entire principle was, the number of dollars we make is tied to patients being healthier and doing better.
That's the way it should be.
Yeah. And the insight there for us was they're a primary care clinic. And they're working with seniors, often in low-income areas. These folks have a lot of health conditions. So the primary care doctors are not able to meet all the needs of the patient. They often send them a cardiologist or an oncologist or a dermatologist. And they were having a ton of problem figuring out which physicians were high quality, low cost, in their metro areas they operated in. They were rapidly expanding. And so it became like a huge operational challenge. And then also just the bare bones of like the phone numbers wrong, the fax wrong, the address is wrong. And so we realized there was this really amazing alignment between the work we were doing and the work they were doing, and actually like the value for the patient and also for their business. It's very much there's like maximized alignment there. Yeah. It wasn't this like tangential use case that, yes, certainly we're still selling to other digital health companies, but it wasn't critical to their business, because like this care navigation, getting their patients to specialty care is a critical part of their ability to make sure that their patients receive the highest quality care and are staying out of the hospital. And so that was like the first like light bulb moment for us in terms of product market fit, because I think it's one thing to get somebody to pay you money for a product, but it's another thing for the product to be like very aligned with the business goals of your customer, which I think makes it way stickier. Way stickier.
So, but in that case, if you're a PCP practice, what is the benefit to you to make sure from like a business standpoint that you are pushing the patient to getting the highest quality care? Like what is that value?
For them.
For them.
Yeah.
Not obviously from a patient outcome standpoint. Totally get that. So where is that alignment?
Yeah. So the way that these like value-based contracts work is whenever a patient has a undesirable outcome, and so undesirable doesn't mean like you never get sick. Like it means like patient ends up in the hospital, things of that sort. You basically get fined, and they take money out of this pool of money that they gave you at the start of the year.
Gets fined by who?
Like CMS, the Center for Medicare and Medicaid Services, is like who administers this, because it's all Medicare.
Okay.
patients. And so imagine like I get $1 million to take care of you for the year. If you end up in the hospital, we're taking money out of that pool. So any amount of money that you're like, it's all about kind of like profitability per patient.
Mm-hmm.
And so where this comes into play, where and it's the beauty of value-based care is where patient outcomes and you making money are actually aligned, which is not the case if you're not in a value-based care system, is the way that referrals work in healthcare. If I'm a primary care doctor, I might see a patient that needs to go to a cardiologist. The cardiologist I send them to is you, my buddy, who I play golf with. And that's how like a lot of this gets done.
Yeah.
You might be a terrible cardiologist and sending people, you're misdiagnosing folks, you're not performing conditions correctly, and then folks are ending up in the hospital. And so there is this like idea that as a primary care doctor, you normally don't care about your patient. You can't control what happens to them after they leave the doors.
Right.
But in these like value-based care providers, they genuinely care so much about what happens to their patients, even outside of their doors, that they feel that strongly to say, like, we want to build a preferred network of clinicians that are specialists, and we will only refer our patients there because we will get better outcomes. And so that's like where it's aligned with that. And it's like, how can you find the highest quality physicians? You actually see a through line there to like better outcomes for the patient.
I guess as a side note, why can't we have this value-based care for the rest of the healthcare?
Yeah. I think first and foremost, it is really, really hard to measure all this. Like everything I just explained, hopefully sounds great, but it's really hard from an operational perspective to manage this. And what I mean by that is you have to do all this extra work, let's say you're a primary care doctor or value-based care arranger, to find the best doctors to send your patients to. You got to do all this work to maybe make sure your patient doesn't end up in the emergency room. When you talk about companies like Aledade, Accolade, I mean, they're doing all sorts of stuff. They're doing patient education for diet. They're driving people to appointments to make sure they go to the appointments. Like you are suddenly getting involved in a lot of other ancillary stuff. It increases your COGS are like way, I mean, like from like a just pure operations perspective, you might be able to make more money if you can get the right outcomes, but like there's a lot more you got to take on. And then from a product and technology perspective, there's so much data you now need to sort through.
Right.
And I can talk a little bit about this in terms of like what was challenging about Ribbon too. But also in the context of value-based care is, I think the name of the game for building successful technology or services is that you have a clear sense of what your North Star is and that it's attributable and measurable.
Mm-hmm.
And where value-based care, I think, is really challenging is how do you prove that a patient had a better outcome than if like they hadn't worked with you? And so what I mean by that is like, it's not as simple as like, oh, the patient didn't go to the hospital this year. Like every patient is different. Different patients have different severity of conditions. If somebody has kidney failure, you are going to expect that patient to end up in the hospital. You don't get penalized. There's just a lot of really complicated.
So you can only measure the worst case scenario. You can't measure the best case scenario.
And you're from like to use product management terms, what are your leading and lagging indicators, right? Like we're talking on time frames of a year or 2 years before you have a sense of like, were you successful, or do you have like a statistically large enough sample size to say that something like this is actually working? And I think that's one of the real big challenges is like, I think when you think about the principles of value-based care, I think most people in healthcare are really, really aligned. I think in practice, it's really hard to administer, one. Two, it's really hard to attribute that it actually is creating better outcomes. Or, you might have a patient who ends up getting hospitalized 6 times, but you did all the right stuff from a value-based care perspective. It's just the patient's really sick, right? Like there's a lot of complicated like risk adjustment that happens where you're normalizing against like patients with similar conditions or severity of issues. And so it's just like a very, there's just a lot of like statistical, like confounding variables and whatnot that I think makes it very difficult to like attribute the value of this And I think that makes it harder for like the entire system as a whole to adopt it, because it's like the classic example is people run like small trials with value-based care.
Mhm.
It kind of works, but it's like not as concrete and like measurable, and doesn't feel as repeatable. And so it's like very hard to convince, somebody to take on 100% risk, which is the idea that like, all of the work they're doing is value-based care contracts.
Is the X factor then basically being able to measure someone's health in real time at home all the time?
Ideally, but then what are the right measures for that
Yeah,
too? Yeah, right. So it's really challenging.
because you have the direct to consumer
Yeah.
companies trying to do that, right? You have
Yeah.
companies like Aura making rings to help you measure
Exactly.
how you're doing on a regular basis. I imagine if you tap that back into these healthcare systems, you can kind of bring that
Yeah.
full circle and start to form some direction of
Yeah.
value-based care.
The other thing I'll say, and I will probably say this this word more than anybody else, is like incentive alignment is like the most critical thing in healthcare in building great products. And one of the other challenges, which is less about like how you administer value-based care, has to do with alignment incentive on the insurance side. So the metric that everybody uses for value-based care, that the easy one, is hospital readmissions. Does the patient end up back up in the hospital? That is the one that the insurance companies are most excited about, because the way it normally works is if you get hospitalized, it's very clear something went wrong, because the patient will get usually hospitalized again within 7 to 30 days.
Okay.
Real value-based care, the stuff that probably gets all of us excited, is like, I start today with maybe a value-based care provider, and I'm pre-diabetic. And over the time span of 5 or 10 or 15 years, you watch me either get healthier or not actually end up developing diabetes. That's actually the thing that drives value for the patient and reduces cost for the system. The problem is value-based care contracts are administered by insurance companies. They think in terms of plan years. So if something doesn't create savings in that calendar year, they're less interested. And the reason for that is, if I'm on Aetna, I can switch next year to United. So like if I'm putting all this money into helping people manage their chronic conditions and it's going to take 3 to 5 years to improve their health, there's no guarantee that this patient is even still going to be in my care and I'm going to actually see those savings. And so that's been like another big like headwind for value-based care, is like this idea that we shop for insurance every year creates this really nice consumer experience, but like it disincentivizes insurance companies to actually do the value-based care that I think is the most impactful, just on a much longer time frame. If you're losing a third of your members every year, you're turning them over, like you don't want to be spending money on all these long-term programs where you see like no net gain in the first year, and you probably are going to lose 1 in 3 patients to another insurance carrier. And so that's, I think, one of the other reasons we haven't seen
I see.
value-based care adopted quite to the degree that we'd like.
Okay, and then bringing it back to Ribbon.
Yeah.
So you guys started to grow. I imagine the complexities around how you actually break in with your customers changes. So talk a little bit about that and kind of reaching that product market fit moment.
Yeah. So first, product market fit, some people buy our product, right? So that was like thinking about just like anybody that wanted provider data. Second, product market fit was, the use case you can power for these like value-based care organizations is like awesome, because it's very tied to their business proposition. I would say tranche 3 of product market fit is realizing that the larger and larger organizations you work with are not necessarily looking for off-the-shelf data. And so as we went more and more enterprise, it became more and more clear that we were not going to be successful as like an off-the-shelf product. And what our customers were really looking for was to combine some subset of, let's call it, proprietary data they had with data that we were selling to get maybe like a composite view. And so that was kind of the third tranche of Ribbon, was thinking through, if I'm, I don't know, a insurance company and I have all this like data on which doctors my members like going to, we can layer that in on top of the data that we're providing to provide even more like combinatorial experience. So it's kind of this, we use the term in industry provider data management, but you can basically just think about it as like a data engineering problem of, we have some like our truth set, and then our customer wants to layer on their custom data points into it. And so that was kind of like the next tranche, was we were starting to work with more and more enterprise customers, and they were not necessarily, well, this is great, can we add some of our own data elements into the mix? And that I think was another, and I bring that up as its own product market fit because you're already really sticky as an API company. Like you just can't, not like replacing. But when your customer is on a regular basis sending you data, you're processing it, layering it back into your product, and then giving it back to them via like an integrated API experience, like you're in like the most sticky version of product market fit, whether they like are having good product experience or not, like they're really stuck with you. But I think like that was something we had a metric as a business, like internally that we tracked, which was the number of customers feeding data back to us. Because that read write back and forth, I think to us was a sign of like they're really, really entrenched. And so we looked at two metrics. One was folks giving us their data to add to the mix, and then folks correcting our data set. We didn't have 100% corrected data set. So if we find out the fax number for Dr. Jones is incorrect, we gave customers the ability to edit that fax number with the correct one when they found it out. And so we were measuring how often customers were writing data back to us. And that became kind of like the third tranche of product market fit, was like that aha moment that like, okay, if we want to go super enterprise, we need to kind of have like the ability to like combine our data with theirs, make it really easy for them to do that. But it's also like in our best interest because it creates a very, very sticky customer.
Is that product market fit though, or is that just scaling something that already had product market fit?
I think a little bit of both.
Because you clearly there was value in your core product, right? Inevitably, as you go more up market, you're going to have to customize your product.
Correct. Yeah.
And so that's why I'm asking, like, how you define still trying to find that kind of third degree of product market fit versus scaling.
Yeah. I think some of it is, okay, let's make the product work for enterprise. So that part maybe is an extension of like the existing product market fit. I think where it was different is, one, we had to more, and this is maybe not product market fit. This is maybe like where I would say like we never fully achieved. But I think this is, to me, the most important part about product market fit is it's not one event. It's many events, and especially for a startup. And I think where we started to struggle, because we got into the third and fourth order of product market fit, is how do you prove the ROI of your products? And I go back to my example about value-based care, right? How do I prove as Ribbon Health that we actually help the patient get to a higher quality, lower cost doctor? Like that is a very complicated exercise. And so as we got more and more enterprise, there was much, much more like financial due diligence that was done on us, both selling deals and also renewing contracts. And I think a constant sticking point. I would say this is about as far as we got in that cycle before, like, we can chat a little bit about like kind of how I transitioned out of Ribbon and what happened with Ribbon. But I think the most challenging part about Ribbon was, it is, you're kind of doing like third order math to back into like the value you think you could have driven. We didn't have like a clean internal way to measure, because going back to my point around value-based care is like, I got to go look at the patient's claims data over a long period of time to be able to retroactively even come to the assessment that like, comparing, doing like an A/B test, like that this patient that worked with Ribbon and actually ended up at a higher quality, lower cost. And so as the digital health market collapsed in 2022 and 2023, a lot of our contracts came under scrutiny. Obviously, we were signing large enterprise customers. The defensibility of your products when your customers are going through a hard time, I think to me like the most special level of product market fit. And I don't think we fully achieved that. I think there's certainly things I would have done differently, or we could have done differently, or ways we could have thought ahead on how we justify the ROI of the product, but we had not really put in that work. And it was also this like hyper frothy digital health time where, you'd breathe and, $500K deals fall in your lap. And so, looking back, I think about that a lot. It is like, it's a lesson I've taken into everything I've done since, is like being able to measure the ROI of your product, have a clear sense of what the North Star you're moving is, and making sure it's attributable. That's the most important piece. Because I think like going back to there's many steps of product market fit, proving to your customers that they can't churn you is very different level of product market fit.
Yeah. That's just long-term retention ultimately.
Yes. Yeah. That's what I think it is, right? Like, then you have like one, probably on the sales side, like very repeatable motion. It doesn't require, this is maybe ridiculous things out loud, but I feel like the dumber salespeople you can have and still sell your product is, to me, a sign of product market fit on the go-to-market side. Like the best companies I've been at, where it feels like it's just like so easy to sell. It's like it doesn't really matter what salesperson you put in the seat versus like, I don't know, I work with some amazing salespeople that can sell terrible products, right?
Oh, I've totally heard founders
So
say this. So this is not
yeah. So that's like I think one. And then on the retention side, I think it's about like the ROI really being clear and measurable and treatable. And to me, those are the two sides of the coin of I think like where there is a point where it's like, okay, we've achieved what do you say product market fit? I think oftentimes people lose the nuance of the many steps. But when we say it, let's just say like what we're actually thinking about is like this final state where you're like, we've got to figure it out. And then you maybe go looking for other things to do. But I think that final state is really hard for those two reasons because like you need to make the product like easy to sell. That any Joe Schmo you pull off the street can sell it. And that you can obtain customers without having to do like all sorts of stuff. It should be clear like what the value you generate to the customer is. And then very clear to them that like that's true and they'll just keep, using your services.
And so tell me how you landed on Medallion.
Yeah.
And maybe actually would be helpful for the audiences to understand the process of you job searching during that time as well.
So, and this, I will all connect at the end with how we started Sonder and what was important to us.
Perfect.
The biggest lesson I took from Ribbon was that one, product market fit is not static. And two, like you have to be able to measure the ROI of your product. And so going into my job search, I was looking for a company where it was very clear what the ROI of the product was and it was measurable. And so, and this is hard in healthcare. I was like, look, there's lots of businesses that I was looking at where I was like, oh, this product is so cool. But I was like, I don't know if like I was put in front of other customers today, how I prove that the product is like moved the needle for the customer. And I think that was true for Medallion because the space that Medallion is in, historically, hospitals, large provider groups, they have an army of like administrative staff that anytime a new doctor gets hired, they do all this paperwork to get them licensed in the state they just moved to. They do all this paperwork to get them enrolled with the insurance company so they can bill for the patients they see. And it's like this 90, 120-day process where the doctor is getting paid a salary and is not able to see patients. So it's pure loss. So any amount you can shorten that is like a revenue generation vehicle for a hospital or, a chain of clinics or whatever it might be. And what I loved about the problem was like, it's clear what the product was meant to do, but then it was also clear like, okay, we are shortening the time to get somebody like, we call it billable for patient services. And we can literally get that down to like dollars of revenue that we're able to help them bring in that year versus like waiting 6 months or 4 months before somebody can actually see patients. And so that was like just an example for like how I was approaching the process and why like the company ended up at why I ended up there. The other reflection was I think product market fit solves all things. As I compare and contrast places I've worked at, you could have the best run company, but have poor product market fit, and then everything goes to shit.
Mm-hmm.
And you can be at a company where everyone's running around like chickens with their head cut off, and you have product market fit, and somehow, despite everybody screwing everything up all the time, the company keeps growing and does really, really well.
Mm-hmm.
And so I think like that was the other thing that I was like thinking a lot more about was like, not that the people part of it or like the structure of the organization or all these other things, culture, all of that matters. But I think like it matters to me to a degree less than some of those like intrinsic product market like fit pieces because, and we'll probably talk a little bit about management and like running teams as well. When the company is doing well, it kind of glosses over a lot of the challenges that people are facing every day. And when the company's not doing well, it magnifies them. And I think one of the experiences I had from my time at Ribbon when things were not going so well, the challenges of people management and like running teams is like motivating folks
Mm-hmm.
is hard.
Mm-hmm.
And so when you're winning every day, even if like the organization's a little chaotic, maybe it could be more organized, maybe run a little bit better, like people are still really happy and excited and it solves a lot of things. And so that was the other thing I was taking into it was like, I think I was like way too focused on like the culture and place I was walking into. Not that that wasn't a part of my search, but I like kind of valued that a little bit less when I was like coming back from my trip and looking at companies because I was like, I knew I kind of wanted like that reflection was like huge, just like winning kind of solves a lot.
We're talking though more startups, right?
Yeah.
Like I assume
Yes.
your focus area was all either
startups.
early stage or at minimum. But
Yeah, I only do early stage startups. So yeah, I was only looking at early stage, and that's partly why like I'm overemphasizing this because unless you're joining so early where it's just like pre-product market fit, then you can't do this. But I was intentionally looking to go somewhere that was like 200 to 400 people.
Yeah.
And come in as like middle level management. And so I knew I was like, what I don't want to do is step into what would have been like something akin to like my last 6 months at Ribbon, where I was like, we were in a really shaky place. A lot of it not even our own fault, but like where the market was. But I think the market was still just coming out of its tailspin from a digital health perspective, early stage digital health. And so I was like, I need to find a place where it's very clear that like the product market fit, you're not going to have like a little bit of like a backslide.
Why do you think that you get more excited about that early stage? Because you could make an argument that a bigger company definitely has product market fit already to all degrees. So that checks that box. The other box is the culture piece that you mentioned, where most likely if they have that product market fit, they're winning.
Yeah.
And so that winning culture then hopefully should create natural effects within the organization. And then if you wanted to focus on kind of being a leader, there probably would be opportunities there too. So how did you make that decision in your mind?
I am someone who always, I think, has had my hands in too many cookie jars. And so I think like speed and amount of things I want to touch, I think are like very, very important. I value, and I think about this a lot in terms of building teams. I think about this in the context of like the company we're building, how I want to build our teams. I really value very flat organizations. And so I think I'm always drawn to early stage. And I actually candidly really like the early product market fit days.
Getting to product.
Yeah, getting to product market fit. Or maybe like you at least, up until like starting my own thing, it was like joining something where you at least had some customers.
Traction.
Yeah, it's some traction. And then you're like figuring out how to like, it's how we're scaling. What are we doing? Like I enjoy that part of it.
Yeah.
And so I think that's like why I was looking early. And I just like the energy of like early. I don't know. There's like camaraderie and everyone's in the trenches.
There's something different about it.
There's something different about it that like I really appreciate it. And so, but at the same time, coming back to the trip, I knew that I was burnt out before I left Ribbon. And so I was like a little wary to go like employee number 7 again. And so I was like, would love to go somewhere where it's just like you can drop me in and I can do stuff and help the company meet its goals, but maybe not necessarily like that early. And so that's why like I was looking like, somewhere between 150 to 400. Where it's like, clearly just leaving the startup phase and moving into scale up, I was like, it would be great to get some experience. I had not had any experience at a company in that phase. And so Ribbon's just entering it before like everything went wrong with the market, but I wanted more experience operating where it's like what we're trying to do is scale what works, not like find what works.
Mm-hmm.
And so that was a lot of what the medallion chapter was about. It's like figuring out how to scale. There's other reasons why like even that chapter, there's some other lessons I took around what I did like and didn't like, but I think it was very much as like, okay, what does it look like to be a director of product where I am not necessarily spending 50% of my time on IC work? Like, what does that look like? And so those are a lot of things that I was looking to learn more about myself around like, is that an environment I'm not interested in operating in? So that's probably why I was looking for a little bit later stage than maybe like what I had done before, which was like joining the first 10 employees. And so I was looking to kind of see what does that scale phase really look like? Because I think it's just very different.
Let's transition to skill sets for PMs. So I have a few kind of final questions for you on advice.
Yeah.
The first being probably the most underrated skill that you think that startups should look for in a PM, just because you've seen
Yeah.
various stages of early stage and now kind of doing your own. What's missing there?
There's two things that pop into my mind. One is I think the PMs that are able to identify, like, I think one of the things that's different about like startups, particularly if like you're one of the first PMs or early product market fits, we don't have metrics that we like have agreed upon that we need like. So I think like the best PMs I've noticed are just really good at figuring out like what metric matters and then use that to like ruthlessly prioritize the roadmap. Because otherwise you're just like the worst thing you can do as a startup PM, I think, is like you spend all of your time like triaging every feature request that comes in.
Yeah.
And part of what happens is you're doing it one off versus like you can very quickly go, does it reduce length of stay? Great. Yes. If not, no. Right. Like, so I think like identifying metrics, I think is like very, very underrated, particularly for the early stage piece, because like nobody's going to hate you like that because they haven't figured it out. We haven't figured it out as a business. And then I think the second thing, and this is the thing that I I don't know. I just say like I think this is the most important skill for PM is like I use the term investigative journalism before.
Mhm.
The ability to understand how to ask questions, how to get insights, and then also to triage those insights. And so the analogy I always give my direct reports, which they don't I guess I roll it now because they use it too often. It's like I think about it as like the symptoms versus the disease. So when you're talking to somebody about like the pain they're feeling or the problem, what you're often getting are the symptoms.
Mhm.
What you need to find is the disease. And it takes really excellent, like, investigative journalism to like tie those symptoms back to like actual root cause. Because I think so many PMs will latch on to symptoms and then build features that don't actually move the needle against like the metrics or the value proposition that you were promising your customers. And it's because like you're not able to like differentiate between symptoms and disease. Right. And I think that is like really, really important in the early days because like you're kind of honestly going out there just asking people a lot of questions, trying to find anything that's interesting, that's worth pulling that thread on. And so it's like so easy to get distracted because like it's not even necessarily telling you what you want that's improved with the platform in front of you. It could be just like what are all the things you're doing with the patient discharge process that are interesting? Like, you know what I mean? Like you have to be very, very careful there. And so that investigative journalism thing, I think, is like super, super underrated, particularly for like this, where we are obviously as a company, but certainly even these companies in like the early years of product market fit once you have some customers.
I would add to that where PMs need to really be able to connect with the customer.
Oh, for sure. Yeah.
And that's really hard to measure in an interview, but building that customer empathy early on can do more than a lot of the other kind of typical product roles that you need. It goes back to what you talked about at the beginning of this entire conversation with what you did when you weren't even technically a PM.
Yeah. 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 I would argue that I would hire a PM before I hire a customer success person if like somebody's like really interested in like going deep with customers and figuring out the product market fit. Like actually that's something there's something interesting there.
I agree.
Because like candidly, like hopefully folks that worked at Ribbon don't disagree with me on this. Like I think I was a big part of customer retention in the early days, like my relationship with the customer.
Yeah.
Because like when I started scaling the team out underneath me or started rolling off another initiative, starting fully another product, internal product, like we had some issues with just like me rolling off being a problem for the customer, right? Because I had spent so much time with them, there's so much trust there. Or like even if we screwed up, like we didn't turn the customer because they like trusted me to like solve it. Right. And I think there's something really powerful about like that's the difference between having PM and like a customer success person or like an account executive is like you have a little bit more agency and outcome ownership there, actually like deliver for the customer, not just like take the request and like run it back up the chain. And so I think there's like I actually like I don't know what this actually looks like for us and we're building out a company, but like there's something interesting from a customer retention standpoint around like that forward deployed product person that I think is really powerful to your point. And I think you have to have the right customer skills to like, um, and to like kind of like, it's a little bit of middle management stuff. Like there were certainly times where I built really stupid features just because I knew I needed to like bank some karma points with customers because I knew that we were going to screw up royally on some other things. It was a little bit of like a game of cat and mouse in the early days, just to like we identified which accounts we need to keep at all costs. And I had a certain percentage of like resources that I had like negotiated with the founder that I was going to use at my discretion for anything I wanted to do. And that included lots of not scaling and one stuff, but it was like really important in the early days because it was like what helped us from like not losing some of those like really critical customers while we got the product to catch up with like what they actually needed to do.
Yeah, you have to be able to do that calculus in your head of
Yeah.
what's okay to just do for the specific customer versus what's better to build for the long term.
And that's how you win when like your competitors are like legacy or like more scaled platforms, because like that's what they're going to see as a differentiator is like your willingness to like do random stuff that they ask. Because like your platform is not going to be good as your competitors on day one.
Totally agree.
Yeah.
On the flip side to that, what do you think is the most overrated PM advice or skill that you have?
I think we're too wishy-washy as a function about like strategy.
Yeah.
And so there is certainly one of the most important things about PM. Like at the end of the day, if you could like narrow or roll down to one thing, it's like picking them. It's like our role, right? Like just picking what to do. But I think like too many folks focus on strategy without like the foundational base. And the foundational base to me is like three things. One is subject matter expertise. And by that I mean like it can be like understanding healthcare. It can also be like understanding your product. Just like
Or customer.
like customer. Like just having the knowledge to even be able to, because you don't have that, like you can't really like how are you able to develop a strategy in the back?
Right.
Like there's so many people that go around and they're like, we take this model from Airbnb around this type of product build, and we can roughly apply it to healthcare. You know, like this just I don't like understand this like reverse engineering style that folks take. So that's I think one. And I think two is like there's like a really famous clip of Steve Jobs, I think at like Stanford, asking people like how many of your consultants, and like most of the room like uses their hand as like MBA students, and he's like his basic idea is like you can't make strategic decisions unless like you have like skin in the game. I think like there's really famous like book by like Nassim Taleb, right? Skin in the game. And I think a lot about that is like I think a product manager's fallacy, this is by the way getting the hot take around being like an early stage startup guy versus like big tech, which I think is a little bit different. Is like I think the best PMs are people that become strategic over time versus like folks that like are strategic, right? You go get an MBA and then become a PM and then work here. Like I think like I just feel really strongly that like some people get there and they have a strategic thing, some people don't, and you maybe then peter out of like PM1, senior PM1, senior PM2. But I think like the through line I see with some of the best product leaders is like the strategic part. I think is just like they approach it very differently, and it's not this like I don't even see them use the word strategic or strategy. Yeah, so, I mean, I maybe rambled a little bit, but I think there's just like something there around like I think we as a like function need to get tighter about what we mean when we say strategy, because I think it can mean a lot of things, and I think we use it very lazily in terms of like what the role is or what we actually could looks like.
Yeah, and I think you form a strong perspective on strategy based on your experiencing shipping product.
Yeah.
Right? Like those are ultimately shaping different perspectives in your portfolio of experiences and will allow you to be able to put yourself in any situation and figure out the strategy.
If I could distill it into one sentence, and I actually think if I could distill the PM career ladder into one sentence, it's how do you make bigger and bigger decisions with less and less information? And then that's I think like the strategy part of it. We can talk about then doing the same thing for getting everybody aligned on those decisions and then executing on those decisions. Those are to me like the three tranches. But when you talk about what is actually meant by strategy, to me it is just that one thing. It's like how do you make bigger and bigger decisions with less and less information?